welcome to the second in our Destination Workplace webinar series. This one focuses on engagement in a hybrid working world. Hello everybody, my name is Barry Winkless. I am the CSO of CPL and head of our Future of Work Institute. The Future of Work Institute is an advisory and think tank that explores, questions and designs future work solutions with our clients. I have to say, I'm very happy to be joined by such a distinguished panel today. And in no particular order, I'd like to introduce Antoinette Switzer. Antoinette is the Senior Vice President with Arlo Technologies of Human Resources. And prior to that, she was the VP of Human Resources for Netgear. Second, I'd like to introduce Keith McCarthy. Hello, Keith. Hello, Antoinette. Both guests, welcome. Keith is the Group Human Resources Director for RCSI Hospital Services Group. Prior to that, Keith has worked in a number of healthcare organizations, and prior to that, worked as a consultant director with Mazars. Thirdly, I'd like to introduce two of my colleagues, I suppose, Deborah Crilly, Director of CPL's kind of HR, retail and sales recruitment team. That team focuses on working with multinational clients, both in Ireland and beyond, in recruitment solutions for those clients. And finally, I'd like to introduce Elysia Hegarty, my own colleague, who is with the Future of Work Institute with a deep specialism in strategic wellness and engagement. So welcome to you all, guys. It's great to have you all here. Before I start asking you some sticky questions, I'd like to remind the audience that, look, guys, for us, the most important thing are your questions. So out of the next kind of 30 minutes, we'd like to spend 10 of those minutes answering some of the questions that you put up on Zoom. So please don't be shy. And as I say, you know, ask the guys really difficult questions. If any of you watch The Chaser, you know, they're the kind of questions that we're talking about here, okay? But without multiple choice, how's that? So Antoinette, I hope if you don't mind, I'm going to start with you. Just look, we've had a, shall we say, a very interesting year for anybody involved in work and in HR. Just could you give us a sense of, you know, how you guys in Arlo have dealt with this kind of this COVID crisis, particularly as it relates to engagement and all of this kind of stuff that we've had to deal with around different ways of working, you know, working on screen, working physically and everything in between.
Yeah, sure, Barry. And firstly, thanks for inviting us here today. I think this topic is superbly important. And so I'm excited to hear what everybody has to say. There's a number of things that we did here at Arlo. And I think the first and most important one relates back to our vision and our mission. So we're only 2 years as a company. And our mission and our vision are very much around protecting and connecting our customers. And around building lifelong trusted relationships with those customers. And so I think a real test of a culture is in a crisis. And so we sort of took a look at what that meant and how it pertained to how the COVID-19 pertained to our vision and mission. And so we sort of very quickly realized that, you know, the whole world was in chaos. The images, the sad images coming from Italy, etc., were very disturbing for people. And, you know, we had the Churchillian moment with Leo Varadkar back in March, and people were frightened for their lives and frightened for their livelihoods. And so we realized as a leadership team that the one thing we could do was to provide some stability for our employees and, you know, to give them some peace of mind. And so we quickly came out with a statement that, you know, we weren't going to let anybody go. People could go and work from home. We already had the tools set up, you know, Zoom and Slack, all those sort of things we already had. We're lucky enough in technology to have all those things in place. So the key was to kind of, you know, take a step back and just provide that element of kind of comfort and stability to our employees insofar as all of that goes. The second thing I think we did was to tap into the leadership across the organization from the CEO down. And I mean, we've been talking for years in relation to talent about leadership and the two sides of leadership, the kind of the business focused on achieving results and profits and all that type of stuff. And then the softer skills, I suppose, the inner game of leadership, and what that means in terms of empathy and connection and communicating with employees. And I suppose there's always been a little bit of cynicism around that part. But again, we, you know, realize that that's actually going to be the most important part of leadership especially initially, in terms of leadership really connecting into that kind of inner game and connecting with their employees on an individual level. You know, we've heard it a lot. Everybody's been affected differently by COVID-19, and that's very, very true. But we really encouraged our leaders to reach out and get to know people individually and have that kind of more empathetic conversation that they've been afraid to have or didn't feel was important in the past. What we also looked at, and again, that's why I mentioned our vision and our mission. We have cameras in 5 million homes around the world, and our customers rely on us to protect them and to connect them. And we realized that, you know, we have a broader societal impact than just ourselves. And so we had a look. We're a relatively new company, and we're not yet profitable. And so we don't have huge amounts of money to spend. But at the same time, there's a lot that you can do with little. And so we looked at the broader kind of societal impact as a company that we could have and how we could bring our employees together to have an impact. And so we collaborated with other organizations, one called ID.me, where we provide a discount on our products to nurses and doctors, people who work in healthcare. We collaborated also with a company called Second Harvest, where we provided for every camera or doorbell we sold, a donation went to this organization. So we provided 400,000 meals to those food banks and people in need. We did that in kind of a broad level, and we did it on a kind of a local level here. We contributed masks to the Marymount Hospice in Cork. And so we really kind of tried to rally people around a common goal that was more or less outside of themselves. Then in terms of, I suppose, the communications, the broader communications top down and across the organization, and they increased in volume, but also the tone changed again to a more empathetic tone, and really trying to connect with people on a personal level. We were lucky enough to have implemented, I don't know if the other people on this call are familiar with WorkVivo, but it's a communications platform developed here in Cork. We implemented that shortly before COVID-19, and it actually—
Using it ourselves in CPL as well, Antoinette, yes.
Oh, you have it? Oh, good.
Yeah, absolutely.
So, but it really came to life for us during COVID-19, from, you know, the more serious communications to pictures of people's pets and, you know, the cakes and all this type of stuff. So again, colleagues around the world could communicate with each other and give each other shout outs, all that type of stuff. I don't think engagement can be fully discussed without wellness. So we increased our investment in wellness, and really tried to tap into those pieces for people to reach out to us in terms of mental health. And I suppose that the last thing I would say, and I think it's quite important, is the whole topic of engagement and culture in and around the crisis. Really, we've brought it to board level. I mean, it's always been at board level, but I think this gave us a real inlet to have a specific conversation and to keep it on the agenda and have board level in organizations interested in and engaged in what's happening. So those are some of the things that we did, Barry.
Thanks, Antoinette. And interesting enough, just to kind of link up with that, from our own research that we've been doing, one of the things I found really interesting was that, you know, people really valued the increased level of CEO and senior level communication as a result of the crisis. And a lot of them felt that was one of the kind of, you know, biggest impacts it had within the business. Keith, I'd love to come to yourself now. Look, obviously, I would say you're uniquely placed, shall we say, as an organization. And, you know, the wave came at you in a number of different ways. Number one, in terms of the organization itself and the role that you play. And then secondly, obviously, this gargantuan workforce that you're kind of dealing with. So, Keith, I'd love to get a sense of, look, I suppose I'd like to take a slightly different angle on this one, because you guys have been working in a hybrid way for a long time. So I suppose my question to you is, you know, what have you learned, I suppose, you know, on your journey thus far? And maybe what are the one or two things, you know, that you'd like kind of people to take away, right, from your own experiences in this world? And I should say as well, Keith, thanks for taking the time as well for talking to us today too.
You know, you're fine. I mean, healthcare, I suppose, really has been at the center of this over the last year or so. And I suppose I'm coming at it from two aspects. One, I'm only in the RCSI hospital group, you know, three months or so, but before that I was the HR director in the Hermitage Medical Clinic. So I have both the operational kind of HR director role there.
I was going to say you joined at an interesting time.
Yeah, absolutely. Interesting is not the word I'd use now. But I think there's a couple of things. I think what really has emerged is a number of things. The first one is that telemedicine and the whole idea of patients not necessarily having to come to a hospital it has kind of fast tracked a lot of that. So they're now doing, appointments online and stuff like that. And that involves a different way of working for clinicians and for nurses and stuff like that, so that they, it's a different way of working. I mean, the patient's not coming to you, you're almost going out to them, if that makes sense, virtually. And so that's been a bit of a challenge. I think I would describe, healthcare, while it's very innovative, it's actually, it's more, a lot of the structures are more traditional in that sense. And I think what COVID did is, I suppose it meant that people had to adjust a lot quicker to that whole concept of not necessarily being in the work environment. So it's very different maybe to technology or Arlo or something like that, where people are used to being very, I suppose, they're using laptops, using kind of the on-screen technology and stuff like that, and that it's quite a I was actually kind of surprised at how much of a challenging step it was for people to go from being in work every single day to suddenly now for a cohort of our staff where they're at home every single day. So obviously the clinical staff are they're there and they're on site, and we need them on site, but then you have a large cohort of staff who are no longer kind of in the workplace, or certainly are not in it as often as they used to be. And I suppose there's a couple of challenges for that in my mind. Managers being able to manage from afar is a challenge, and that whole view of them being able to, they need to trust and they need to empower and they need to put structures and processes in place so they can manage and get things done even though someone's not sitting beside them. And I think that's a difficult transition for people to make who are not used to an environment where they're operating maybe, kind of internationally or something like that, when they're used to having the person beside them and you go into the office next door, you know what they're doing, you know where they are. That is a bit of a challenge. And I think, getting those structures in place I wouldn't say it's right by any manner of means at the moment. It's still a work in progress. And I think it's a behavioral shift, I think, that's required. I suppose the second thing for me really was it's the extension of hours as well. As an employer, we're always trying to be flexible. So now where you had them in the office 9 to 5, now people are working, they're doing a bit from 7 to 10, then they're going off to drop the kids to school. Well, maybe I get thrown off, drop the kids to school, then they come back and they're doing bits from 6 to 8. And I certainly know my own day has extended and extended and extended because what you're doing is you're still managing the different hours that people are doing, and you're getting inputs all the time from your, through email and stuff like that. So that's been a bit of a challenge. So it means there's an adjustment required, I think, for people to bed down into that new way of working. And you don't have to respond to emails at 9 o'clock just because somebody else is actually responding at 9 o'clock. It doesn't mean that you have to react to that. So I think there's a shift in that. And the other bit then, I think Antoinette touched on it there as well, the health and well-being side of things for us has been a huge, huge piece. And we've tried a lot to say to people, look, if you're working from home, it is difficult. There are people who've had childcare issues. They've had, issues in terms of 3 and 4 and 5 people trying to work in a 1-bedroom apartment. There's all sorts of things that they're facing, and it's not easy. And I just had a call this morning. Actually, we're launching a new EAP service now from next Monday, because we just see the importance of it. We've put in place COVID hubs, we put in place information, we put in place occupational health assessment process, and so on and so forth. But it's difficult, and people are finding it difficult, and it is not easy. It is not as easy on paper. It might sound easy, just working from home. You're simply lifting a laptop. It's not that easy. It's quite challenging, and I think people are going to. I think the consequence of this, will be felt. I think not just even this year, but in 2021 and 2022 as well. So I think we're on a journey. I actually don't think we're anywhere near, putting aside vaccinations or any of those other things. I think we're on a journey of change. But I still think the challenges are there, and I don't think it's going to be simply just a switch that's flicked now in February or March or April or June when people are vaccinated. I think it's going to continue on, and I think on the positive side, a lot of people say, I don't want to go back to the office 5 days a week as well. So I think we're going to have to shift our thinking a little bit as well, and that's okay. And I see that already when we're recruiting people, they're kind of saying, I really want to work 3 days at home and 2 days in the office. And to me, that's fine. But we need to build our structures and our processes around that, because I don't think it's there yet.
Yeah, great. Thanks, Kate. And Elysia, that kind of leads me nicely on, I suppose, to you. You're obviously doing a lot of work in the Future Work Institute on this area that we're calling strategic wellness. You know, and I know you put a lot of kind of, you know, focus on this idea of interconnected wellness, you know, so can you talk to us a little bit about, you know, that lens, if you want to call it that, that wellness lens on the impact that this kind of hybrid world is having from the research you're doing and some of the companies you're working with, you know, maybe kind of tied up with both what Antoinette and Keith have kind of brought in there.
Yeah, for sure. And I love that, you know, it's something you've both kind of touched on, because I think it's really important now, not just because obviously there's a huge emphasis on health and well-being, you know, all year, you know, but I think that, you know, when we're looking at it from an engagement perspective, there's a lot of research out there around how using well-being programs strategically to boost, you know, engagement. Obviously, our priority is looking after the health and well-being of employees, but we also know from a business perspective, healthy employees are engaged employees, and engaged employees are more productive. Also kind of supports the bottom line for managers as well. So I think I love that it's something that you've both, you know, in your organization, included in terms of your strategy, put more investment around it in that as well. And a lot of the organizations that we're seeing at the moment are doing the same. In terms of the market, we're seeing trends. Obviously, a lot of stuff is going virtual now. And I think that from wellness perspective, a lot of that will maintain, you know, implementing different types of wellness technologies and delivering wellness programs throughout, using technologies and apps and webinars and, you know, Zoom and stuff like that. So I think from what you've said there as well, I think that's a huge piece. And one of the areas that we look at, so we look at wellness from, say, an 8-dimension lens. So whilst we're also kind of focusing on supporting people's, you know, mental health and physical health, we also know that there are other things within work environments that can contribute to people's stress levels. And we know the number one cause of stress is work-related stress. So I love that you've kind of talked around, you know, communicating to people and leadership and that as well, because again, as you say, leaders have had to adapt to these as well. And if they haven't adapted well, then that's putting further stress or burden potentially on teams as well. So I think that, you know, looking at it through that multi-dimensional lens and getting, you know, the leadership involved is really, really cool. It's really important. Particularly, I think, for culture as well. And one of the things that I've seen in some of the research that I've been doing, particularly around leadership and its impact on not just wellness, but engagement, and that is promoting this kind of tribal mindset. So it's based on this book called Tribal Leadership. I forget the author, really apologies. But again, it's looking at building that kind of tribal mindset, that it doesn't, when we do move into that hybrid, you know, physical people, some people in the physical, some people working virtually, that it doesn't become an us or them. And I think that this potentially could be one of the ways that we'll see culture kind of change, where we have this kind of tribal mindset or a tribal leadership, in a way that leaders are encouraged to not just make people feel part of a team, but that people from all over the world, no matter where they're working, you know, feel part of one particular organization. And I think that we'll see that shift in the next number of months in terms of culture, in terms of well-being, in terms of leadership.
Thanks, Elysia. Deborah, I'd like to kind of bring you into the conversation now, because look, obviously you're kind of seeing it from a, let's say, a different perspective. And you know, one of the things that, you know, we're seeing with companies we're working with is this kind of, let's call it the evolution of HR, right? The evolution of the HR role, right? And you're kind of seeing it on the other side. You know, you're seeing it from a, you know, what companies are looking for from their HR professionals. Can you give us a sense of what's out there, what's happening, what you're seeing in, because I know we had a conversation ourselves about this, you know, what's happening out there in terms of what people or organizations are looking for in their HR and people professionals?
Yeah, thanks, Barry. Yes, I mean, there's definitely been a shift in, I suppose, maybe the context and the content of HR roles that we've been seeing coming in from our clients. Definitely a shift in the well-being space, you know, from ambassadors to HR partners that are specializing specifically in that space. And that's a it's become a huge role. I mean, we started to see that sort of percolate in the market over the last couple of years, but I would definitely say the last 9 months, we have seen a huge shift in that from the clients that we're working with. Also from an e-learning, there's been a heightened, I suppose, perspective around learning and development and how that's shifting to an e-learning platform. I mean, we're fortunate enough from an internal perspective, we've been sort of using an e-learning platform for a couple of years prior to COVID, but a lot of businesses now have been kind of, as a result of COVID and working from home and that remoteness, being catapulted into that space, and have had to embrace it, I suppose, more quickly than other businesses that were strategically planning for it. So there's been a big shift in that also. And then there's been a huge amount of virtual interviews. Actually, there's still been, up until restrictions were very tight, and there were some face-to-face, but I would say 90% plus still virtual interviews and virtual onboarding, which has its own challenges, of course, when you're looking at trying to introduce a new employee to a business and whilst virtually onboarding them around, you know, cultures, values, the mission, what their role is, and the learning and development piece as well. So it's been quite challenging. And then we've had parts of the roles that have gone digitized. So we have a lot of digital administration now, e-contracts going out that have seen a result of maybe specialist HR administrators coming on board to help facilitate that across businesses. And I suppose we have seen a small shift on temporary and contract requirements across the industry as well, and across the HR functions from clients. Not as much as you would expect, actually, I suppose, just given the current climate. Still, a lot of the clients are investing on permanent hires, but the permanent hires have become a little bit more focused around learning development, organizational development, well-being, wellness, and that whole engagement piece, you know, that is huge, obviously, across the business. And funny enough, talent acquisition has probably picked up on a temporary capacity rather than on permanent. Because in some industries, talent acquisition has probably dropped, where it's not a priority for the business, and then in other, like for example, healthcare, I'm sure talent acquisition has just soared. But we're not seeing those level of roles, I suppose, out there in the marketplace. They've taken a little bit of a dip since COVID has started.
Thanks, Deborah. So guys, just on that, and Antoinette and Keith, I'd kind of like to kind of pose this question to both of you, and it'll be the last question before we move to a couple of Q&As. You know, obviously in terms of this hybrid working world, I think, you know, from our own work that we're doing with many clients, you know, it's pretty definite that there will be a form of hybridization happening right across most workplaces. From the HR perspectives, you know, as you guys working within your role, how do you see the HR role evolving as a result of this hybridization? You know, what else will you guys need to worry about, or how does the context of your role change? And Antoinette, I might ask you first, and Keith, then I might ask you to come in as well, please.
Yeah, that's a great question, Barry. So I think what's very important is that we don't waste the opportunity of a pandemic, and by that I mean that with the best will in the world. I don't think, well, for me, certainly I didn't go into HR because I love kind of, you know, policies and processes and all of that sort of stuff. And many of us have been, you know, for years really trying to have an impact in terms of the overall kind of strategy of the organization and how the culture and strategy kind of come together. And I think now is the time. I mean, the financial crisis, as we know, is when people relied very much on their CFOs and their finance team. And over the last few months, HR as a group, including learning and development and wellness and all of the different elements of human resources, have had really an opportunity to demonstrate how important the people in the organization and the talent in the organization is in terms of really contributing to those kind of financial outcomes. And I think it's extremely important that we take a step back, actually, and don't look to go back to normal. I think what HR can really do over the next number of months is to try to really take what we've learned and, you know, have a look at what has not, you know, the things that we want to kind of get rid of from the past, and implement the best of those things that we've learned over the last number of months, and really kind of start again with a blank page. This is the opportunity for us to do that. I think the time is now, and if not us, who? So that would be the biggest piece that I think in terms of opportunity for HR as we go forward. It's really to take the opportunity now. We're in the strategic conversations at board level, at exec level, at CEO level, and broader in society, and to really take that opportunity and capitalize on it for ourselves and for the talent in our organizations going forward.
Thanks, Antoine. You know, I'm definitely very aligned in our thinking there, as you know. Kate, I'd love to ask you the same question. You know, obviously with your very specific set of circumstances, I'd love your view.
Yeah, I think I'd agree with Antoinette. I mean, I don't particularly want to go back. I think we have to go forward. I think COVID has presented a lot of very good opportunities. Actually, I know that's maybe not the right thing to say, but you know, from an efficiency point of view, it has driven a lot of efficiency and will continue to drive efficiency. Particularly, as I said earlier on, more traditional organizations. You know, I'm an efficiency fiend, and I can't. I hate paper, but you know, it's to try and drive a lot of that continued efficiency, and I think people want it. Actually, I think that's one thing that I've seen. Actually, is that when we talk to people, like, they don't want to go back to the way it was. So, and people can operate from home, and they can operate, and they're trying to put processes in place now that will allow them to operate that. So I think that's the first thing. I think the second thing is that, you know, from a strategic perspective, I agree with Antoinette. I think HR have really stepped up over the last year or so. And particularly, I found, you know, especially back in maybe February or March, where a lot of this uncertainty was coming through, HR were the ones that people were ringing. What does this mean? What are the questions? And they were looking for guidance. And I think HR really did a very, very good job in reinterpreting maybe some of the guidelines and the policies and the procedures. And I mean, you know, everything from contact tracing to you name it, you know, we were kind of heavily involved in it. And actually, in a way, it's I think it actually people got to see that HR do a significant amount, and maybe more than people actually think. And I think going forward, then I think what it is, it's a couple of things. One is that we need to look at our ways that we engage with our staff, and I think we're going to have to find new ways of touching base with them, of keeping engaged with them, of supporting our managers to teach and learn and to train them how to engage in a hybrid world. And it's not natural for every manager to have that. For some, it's absolutely, it's you know, they talk to it like a duck to water. Others not so. And I think what we need to do is to, when we talk about performance management, when we talk about organization development, and we talk about all of these other things, we now need to think about it in the context of a hybrid world, that people don't necessarily need to be in the clinic or don't necessarily need to be in the office, and the processes and the structures and the policies and everything else around that now needs to reflect that type of working. So I think we've a huge amount of work to do now. As I kind of said earlier on, we're on a journey now. I think we have a huge amount of work to do. But I think we've really stood up over the last number of months, and I think that will continue. And we just need to, you know, we need to take this opportunity and keep going with it, and make sure that we can drive home a lot of the things that we wanted to be driven home for quite a while. So I think it's been a positive thing in some aspects.
Sorry, guys, I should also give a shout out to our own HR director, Sharon Vise in CPL. Yeah. We have driven a lot of, you know, engagement practices in our own organisation. So that's a shout out for Sharon. So guys, just with the time that we've left, I'd like to switch over to a few Q&As. So these are the ones, guys, that I can't vet in any way. So you're going to, so apologies for that. Okay, here we go. So we've got one. Has any function thrived better than others in the organizations that we're speaking about here? And we've got a sales question mark, support question mark, marketing question mark. It's a bit of a big question. So that's the first question. I'm going to talk about the three first. Deborah, you might answer that one first.
Okay.
There are a couple of really good ones here. So this is a good question, guys. What does the panel think the top 3 priorities are for HR leaders in the coming year? So we might take those 2. Deborah, I might ask you to answer that question around this kind of, I suppose that's more from a talent acquisition perspective, out in the marketplace, what are we seeing in terms of, the kind of roles out there? Can you give us a sense of that? And obviously maybe through the HR lens as well, I suppose.
Yeah.
Thanks, Deborah.
I think, am I mute? No, I'm not on mute.
No.
Sorry.
No, you're okay. We won't tell you if you're on mute anyway. So
I know. Probably better. That's going to be the quote of the year. I think I'm on mute.
I know.
Yeah. I think recruitment, definitely on the onset of COVID, it had reminiscences of the last recession, I suppose, because there was a huge amount of uncertainty. And certainly in the first few weeks, it was really rallying around how are we going to shift the business, how are we going to pivot the business, and what are we going to do really to help support not just our own business, but also our clients' businesses, and also to support our candidate community as well, I suppose. So there was a lot going on. But I think as the market, certainly the first few months were tough. I think it was tough across every business and every client that we were working with, because they had to pivot their business and they had to change their recruitment strategies as well. Some were stalled and put on hold, and others were sort of pivoted depending on the industry that they were in. But definitely from a business perspective, I mean, if we take even my 3 areas that I manage, HR has been solid throughout the COVID, throughout the period that we've been all sort of navigating through over the last sort of 8 to 9 months. The sales and retail space has pretty much like been annihilated, purely because of the impact on those type of businesses over the last number of months, significantly the last 6 months. With the exception maybe of technology and those typical sort of remote working spaces. But finance and technology and logistics, and actually some parts of the business have really thrived throughout the COVID situation, like healthcare, supply chain, logistics, technology, a lot of the implementation required for businesses. So a lot of that sort of recruitment heightened to an extent for a certain period of time. So outside of, I suppose, the key areas, I suppose we as a business have 17 or 18 divisions, so we recruit in virtually everything. But I would say most divisions are now starting to see an uplift on that trend. Recruitment did take a back seat probably for the early months, but it's now starting to lift again, which is fantastic. But certain pockets not as fast as others, and it's very dependent on the industry. Like if you think about hospitality and some of the service industries and the retail industry are hugely impacted by COVID, and then flip that with healthcare and technology, pharma, logistics, hugely busy. So it's kind of like a balancing act.
Thanks, Deb. So guys, let's talk about these 3 top priorities for you guys as HR leaders for the coming year. So let's put it in context. So let's talk about this year. Antoinette, you kind of mentioned about this opportunity to kind of, I suppose, support organizations on looking at HR afresh. So are there any other ones that you put, Kate, you mentioned about this kind of, opportunity to kind of give people the skills to be able to work in this hybrid world? Are there any other kind of core priorities that you guys see as really important that will be right on the top of your list for 2021? Keith, I'll ask you to start if that's okay.
Well, I know from my perspective, I think top of our list will be the employee assistance and the health and well-being, and that's just not lip service to it now. That is something that we are very concerned about. The given healthcare, the level of burnout and fatigue, and is going to be a bit of a challenge, to be honest. So I would say for us next year, that will be a primary focus, and it'll be supporting staff. We're looking at, at the moment, putting in place occupational health hubs with psychologists and stuff like that to assist with certainly my own group anyway, within our own hospital group, looking at putting those type of structures in place, because as I said, I don't think the issues are now. I think the issues are next year and the year after. And I think our staff have been impacted significantly over the last 12 months or so. So for me, that would be amongst other things, but that would be one of the things that would be very top of our list, and just trying to give the staff the supports that they need. And that's my primary one, I'd say, going into 2021 anyway.
Thanks very much, Keith. Antoinette, if I could ask you the same question. I know you're mad for policy documentation and all that kind of stuff, so I'd imagine that'd be in your top 3.
I'm just about to rewrite the handbook, Barry, after this.
Yeah. The tome.
Yeah. No, I would agree completely with all that's been said already, and it's just something that I will add to this. And Arlo is very much a multinational organization with dual headquarters in California, 2 locations, San Jose and San Diego. And in the US as well as outside of the US, there's sort of been 2 crises: the pandemic and the social unrest that has come to light in the last number of months, and probably has been brewing for a very long time. But what's become very, very clear is that COVID-19 hasn't had the same impact on everybody, and that people who were already marginalized are increasingly so. And so it's something that I think we're very conscious of, and I'm very conscious of here at Arlo, again, as a company who has a vision statement, claim to protect and connect. We really want to tap into that from a HR perspective and see what that means, both for our employees and for the broader community and for our customers. And so we're really going to focus very much on diversity and inclusion, and all of what that means in terms of not just the numbers game, but also the numbers game, and really tapping into talent, that a diverse and inclusive talent into the future, both within the organization and outside. The other thing I will say is, and I touched on it earlier, leadership. Continue to really kind of invest in our leaders, because they're the people, paying attention to our leaders will really help us going forward as an organization to become profitable, which is in our future, hopefully. And so we're really going to focus on building the leadership talent in the next year. So those are those key areas, apart from those that have been mentioned already.
Great, thanks, Anna. Just to add our own perspective, I suppose, on that, definitely from our own work that we're doing, I think one of the things that this hybrid kind of world is really forcing, I suppose, in a little way, is this kind of revision of leadership and what level of management is appropriate, right? Because we're almost forced now into a self-managing type of organization. I think for me, it's one of the priorities I would like to put out there for leaders in particular, is to understand and explore what is the right mix of a level of empowerment and self-management, working with people like yourselves in HR and really nailing, an approach that kind of works within the culture of the organization. Guys, what I think I'd like to do now is finish it off here, if that's okay, because believe it or not, we are 40 minutes in and we've managed to answer many questions, and I think we've garnered lots of insights, and I'm mindful of everybody's time. So guys, I'd like to first of all say thank you to yourself, Antoinette, Keith, Debs, Elysia, and thanks very much for kind of lots of insights there. I know I've learned a lot today as well. I'd like to also just kind of point out a couple of things on the important dates, I suppose, in the future work perspective. One is, there's a Reimagining Wellness white paper out there developed by the Future Work Institute that's downloadable around this whole area that we've done a lot of research on over the past 2 years. And then the second piece is a joint collaboration white paper coming out over the next 2 weeks that we did in collaboration with the American Chamber, called The Future of Work Pathways and Perspectives. And there's lots of really good insights on that. Antoinette, I know you're involved in some of the working sessions there. So two kind of important things just to call out there. I'd also like to just thank everybody who's worked with CPL and the Future of Work Institute over the last year. And I really wish genuinely everybody a fantastic 2021. I think we can all agree. It'll be better than 2020, excuse me. So thanks very much, guys. And if you'd like to say bye on your own behalf, guys, thank you.
Great. Thank you.
Thank you.
Cheers.
Thank you.
Bye-bye.
Thanks so much.
Bye. Thank you very much.
Take care.